Good morning. Today we're going to go over Chapter 11, drug calculations, and we're going to cover the metric system. We have the gram, liter, and meter. You've seen this before with your ChemCal. We're just going to give a brief review over this and move on. So basically, you want to know the difference between the three, and with your accuracy and calculate drug dosages with the systemic process to be used. The same process should be used with every drug calculation. That step is not missed. Missed steps could lead to errors and cause serious harm or death. With this, you want to make sure that you have any doubt. Make sure you have a team member with you until you have your confidence. And even when you have your confidence, you just always should double check on, especially insulin. Calculate the correct dosages, knowing how to convert from one unit to another, essential because of the fact that the basis of the drug calculations. And the two systems, you have the metric and the household. It's really gotten to where we're more of the metric even in the household. We have the metric system is a decimal system based on the power of 10. So keep that in mind. The basis of the measurement is used the doses calculation, including the gram, for the weight, for liter, and for the volume, it's meter. And now because of that lack of standardization of spoons and cups and glasses and all that with a household measurement, that's why we're wanting to go towards the metric system overall to produce, give consistency even at home use and reduce the risk of fatalities or overdose or not getting the adequate amount of medication that they need. Now, a teaspoon, if converted, is usually means 5 milliliters. 3 teaspoons is actually 30 milliliters, which is 3 as a tablespoon. And then we have the ounce, which is 30 milliliters. And we have, so because the household measurements are not accurate, instruct the patients and caregivers to obtain the approved drug measuring device, and you'll get that at any pharmacy. They'll give that to you. This is just a little conversion table you can see and note. And then the interpretation of drug labels. You want to make sure the calculated method for internal and paternal drug dosages. The pharmacological companies usually label their drugs and with the brand name, so also with the trade name. First in large letters with the generic name, second in the smaller letters on the labels for the generic drugs, only the generic name of the drug listed. The formulation of the drug is amount of per tablet, capsule, unit, or liquid for oral or paternal doses. Now it's printed on the drug label. Other information found on the drug labels includes lot number, expiration date, proper storage, and where to store it, and whether it is a controlled substance or not. Be aware of the drug names that sound and look alike. Now, to decrease med errors, nurse administrating the drug should perform the 3 label checks with the patient's medication administration record, the 3 general methods from the calculation of drug dosages, basic formulation, ratio, and the proportion fractional equation, and the dimensional analysis. The nurse should select to do the methods of drug dosages and use method consistently. Now, it is most helpful to convert the system to the drug label. The drugs that require individualized dosing and the calculation by the body weight, make sure you are doing that, because especially in pediatrics, you're going to see more of the body weight recommendations by kilograms. So by the body surface may be necessary. The basic formulary is the recall for the um, drug label, and then where you want to do the calculation for the basic formula. You want to have the D is the desired dose, H is the drug on hand, V is the vehicle or volume of the drug, which is the form of tablet, capsule, liquid, which would be measured in milliliter. And then A is the amount of calculation to be given to that particular patient. So the ratio of portion, you have the method that can be expressed linearly or as a fraction, and then a fractional equation. The linear setup, you can see it set up like, I'll show you, for instance, you have just like if you will review your ChemCal book, and you have your volume and the vehicle or volume, then you have the desired dose and the patient, and that's the outcome, where D is the desired dose as ordered, H is the drug on hand, V is the vehicle or volume or the drug, tablet, or capsule, and then X is the unknown amount of to give the patient, and that's all calculated. And you will see, just like we had for our first week of clinicals, having to study ChemCal doses, and you have to always remember that. Because you may be in a remote area where you don't have your handy little calculation that you can use on your phone or app, and you will have to relate back to your fundamentals. So always just embed that into your brain. Dimensional analysis is a calculation method known as units and conversions. As we were talking about, the D, H, and the V are still used in dimensional analysis. The advantage of dimensional analysis is all the steps for calculating the formulas. However, you got to make sure that the conversion factors still need to be memorized. And that is real fundamental. You know this, you just need to keep on brushing it up. Want to always remember the ounces, drams, grams, all the different ways of calculations. Now, tablets and caplets can be rounded up to the nearest half if they are scored. But remember, if they're not scored, you have to make sure it is not something that cannot be crushed. Liquid drugs can be rounded up to the nearest tenth. The exception to the rule is when you're calculating dosages in drops, which is round up to the whole number, or in pediatrics. You cannot round up. You want to make sure it's to the precise kilogram dosage. When rounding, determine how the placement beyond the decimal point and where it's appropriate. And always remember, when you're placing that decimal point, you put that 0 in front of it. And then if the number to the right, a digit needs to be rounded and is less than 4, round down. If the number is to the right and the digit needs to be rounded up, which is 5 or greater, round up on an adult dose. The body weight, the calculation allows the individual to look at this. And then, so just keep on looking at the methods of calculation here and the examples of that as you're going through PowerPoints on your own. And I have it to where you can download these. And I want you to keep on reviewing them. Now here with the body weight, the method calculation allows the individual of the drug dosage in the individual involves the following steps. You want to convert the pounds to the kilograms, and you always divide it by 2.2, and that is equivalent to 1 kilogram. Determine the drug dose for the body weight by multiplying as follows. You got the drug dose times the body weight equals the patient's dose. And then follow the basic formula ratio in the proportional fractional equation or dimensional analysis method to calculate the drug dosage. Now, the measurement of the body surface, the most precise method for calculating the drug dosages is you can measure it using the West nanogram or the square foot method. And then the West nanogram is measured with the squares, and it's determined with the patient's height and weight. The most precise way to determine this is to use the square root method for the calculation. So if you'll look at this, you have the calculated drug dose, multiply the drug ordered by the number of square meters. And here's an example here. And then you want to make sure when calculating the BSA using the centimeters and kilograms, the following formula applies. You're going to have the BSA equals height in centimeters and the weight in kilograms divided by the 3600 constant. Now, when you're reconstituting the medications, and paternal drugs may come in a powder form, and due to the drug instability in liquid, you want to be precise in diluting that medication. The liquid used for the reconstituted is, of course, called the diluent, and the nurse must follow directions to reconstitute the label exactly. Because if you don't, you're going to get a increased dose or a decreased dose. The oral drugs are available in a tablet, capsule, powder, liquid form. Oral medications are absorbed by gastrointestinal GI tract, mainly from the small intestine. Oral medications have several advantages. They're convenient. They don't have to have any assistance. The cost is minimal, and you're less preparation. Oral medications, they're easy to store. Now, the disadvantages are the variation in the absorption, depending on the person's health, their age. May result in interaction with the food, GI irritation. There's a pH variation in GI secretions. Different people absorb differently. So destruction of partial interactive of the drugs with the liver and liver enzymes, and many tablets are scored, and so therefore they're readily broken in half when needed, but then there's some that cannot be broken in half or they cannot be crushed. So capsules, this is sustained release, the controlled release, not crushed and diluted because of the fact the medication is absorbed at a much faster rate is indicated because of the fact they intend it to be time released. And so therefore it will actually, the onset, the duration, peak, and will totally change. And it can cause interactions with different medicines or actually different issues with the patient overall. Liquid medications are ideal for G-tubes, so you have to keep that in mind. And you want to, if it's available, use it. Tablets with inert coating is the hard shell. It's not meant to be crushed because the medication could irritate the gastric mucosa. Now, when they put the coating on the medication, it is meant to pass through the stomach and then it absorb into the small intestine where the drug coating dissolves and the absorption occurs. Now, some medications can be absorbed through the nasogastric tube or through the G tube if the patient is receiving the tube feeding. The drug should not be mixed with the feeding solution. You want to stop the feeding solution and flush it. You want to get a regurg, see what regurg you're getting in the gastric, see if it's absorbed. Because if the medication's supposed to be on an empty stomach and you're getting a 50 cc return, that means that the patient still has food or the the feeding in the stomach. So you want to flush that. And then with the when you're flushing, you want to flush via syringe, and then you also want to follow once you give the medication with another 15 to 30 milliliters of fluid to ensure the drug reaches the stomach and therefore bypasses the stomach. And that way, once you reconnect the tubing for the feeding, it won't interact with the medication. When the medication, the ability to swallow, because you always want to make sure with patients that have had strokes or they're in a state of altered state where their swallow studies indicate they cannot have anything by mouth. Alternatives have been put into place for that reason. And so therefore you do not want to make a mistake, and that's why you want to know your patient. And now some interactions you'll see are going to be with the gastric juices or the enzymes or the actual person that is taking it orally. You don't want to make it readily habit to give grapefruit juice with the medications, because there's so many different medications that it interacts with. What we just talked about and just different considerations. We're considering the calculations of dosages of paternal drugs, injectable syringes, vials, ampules. Now, there's a difference between the ampules and the vials. With the vials, you're going to see that you're going to place air into the vial. With ampules, you'll want to use a filtered needle to pull up the actual medication. You always want to make sure you check the expiration date on the medication before administering. Directions for the administration. If the drug is powdered, you always want to make sure you're mixing it properly before it's given. Now, with your drug calculation in units, you have to make sure you do not get that mixed up with milliliters, because a unit is one unit is a 100th of 1 milliliter. And so you're dealing with units, you're actually usually administrating the insulin dosages. Some drugs are measured that way to includes insulin and heparin. Typically, units are not converted to any other measurement. So at least that is straightforward, and you won't have to worry about that. But just remember, do not get it confused with milliliters. You could cause a fatality very fast. Insulin is prescribed and measured in the United States Pharmacopedia, and it's actually in the units. Most insulins are produced in concentrations of 100 units per milliliters, and then the insulin should be administered with an insulin syringe, and idealistically in a low dose insulin syringe, because usually it's not going to be a high dose unless it's a chronic case of diabetes. Administering insulin with a tuberculin syringe should be avoided, although both are the same in the way of measurement. The tuberculin syringe is calculated in milliliters also, and so you can get confused. Now, with your calculation methods with intravenous flow rates, you have your IV therapy is used to administer fluids and that contain water, dextrose, vitamins, electrolytes, drugs, depending on what's ordered. Methods of the administrative include a bolus, IV push. It's usually with the syringe. Intermittent infusions with IV piggyback, which is normally antibiotic therapy. It can be a wide range of. It can be insulin. It can be so many different things with piggyback. So you have to be very careful, and you cannot, most likely, there's so many things you cannot use the same tubing with. So be careful with that. Medications administered with the rapid onset of action, you got to calculate with the errors of what it's being administered with. Because if you give a mixture of one medication with vancomycin, you can mix anything with so you want to be careful, because the things that it could interact could be fatal. The drug inserts must be read carefully, obtain administrative information, and must give attention to the amount of drug that can be given per minute. If the drug is pushed in the bloodstream at a faster rate, it can actually be necrotic and cause damage. Just make sure the adverse reactions won't occur. Now, many IV drugs irritate the veins. Phenergan is one, and Vanc is one, for just a couple of examples. And so if you do not dilute it prior to administration, you're going to be restarting an IV. Now, in some patients, you're not going to get another IV, so you want to be very careful. You're going to have to call the house supervisor. You're going to have to call anesthesia. And when you're dealing with a number of patients and we're looking at the interest of the patient, you're not going to want to take that time, and you want to do it right the first time if possible. There's so many tools now that you can ask, call the house supervisor first, because if you have deep veins, there are tools now, then it basically, I want to say an ultrasound, and where you can actually see the vein. And if you're unsure, you can get one. You actually can get a good stick. The nurse calculates the IV flow rate according to the IV tubing a drop factor, and you will rarely see that anymore, where you will see the dilaflows. But when you do see a dilaflow, it's actually educational, because everything's so much IV with the IV pump now. But then with the setup that delivers large drops, which is 10 to 20 drops per milliliter, is a macro drip. And now one that delivers small drops, which is like 60 drops per milliliter, is a micro drip, which is a mini drip set. So anytime the primary IV fluids give a slow rate ordered to keep the vein open, you're basically especially going to see that with congestive heart failure patients. You're wanting just to keep the vein open, but not over give the fluids. Now, for keep the vein open, the most you would give, is say 60 drops per milliliter and 250 milliliters of IV solution. And so the KVO is usually regulated to deliver 10 to 20 milliliters per hour. You never want to exceed that 30 milliliters per hour when you're doing the KVO. Drugs prescribed as IV piggyback are administered via separate tubing and IV drugs with a secondary line, which we talked about. You want to make sure when you have several IV piggybacks, it doesn't mean those lines will be compatible. So you want to have separate lines for each piggyback dose. So the IV connector on the continuous IV will connect to the primary IV tubing. 2 secondary IV administrative sets available. The drugs are the calibrated cylinder with the tubing. Just make sure they are calibrated and there's no contraindications. When the continuous IV infusion is discontinued, but the patient still requires IV access, IV tubing is removed with a saline lock is attached. They used to call it a heparin lock, but now they call it a saline lock. It's used and it increases the patient's mobility, and it's more cost effective because less IV tubing and the equipment can be utilized somewhere else. Now, just remember that the length of time, even though you're going to a saline lock, the amount of time that you can keep that IV or saline lock in is the same time. You have to restart after that per policy for the hospital. IV pumps are recommended for use of IV therapy. However, some non-critical IV solutions can be administered using gravity by manually calculating drops per minute. And you'll see this, it's getting to where in some more cost-effective areas in the hospital where they're trying to have cost-cutting measures. So you'll want to, that's when you're really going to have to work with your drug calculations, because you're going to have to be doing it manually. Now, you're going to have problems with IV infusions. You're going to have kink tubing. You can have a positional issue where the patient, if it's in their wrist or if it's antecubital, which means right at the elbow in the forearm, antecubital site, if they bend, they're bending that cathlon, and that cathlon will actually kink and it will occlude. And so you will have to remind the patient, especially if they're mentally altered, to keep the arm straight or find a better site so you're not constantly in the room. Now, ongoing nursing assessments, you want to always continue to keep the IV site assessed to make sure it's not occluded, it's not infiltrated, because when we're doing IV therapies for infections and things like that, and it's going through the interstitial space and not in the actual vein, we're losing that medication, and that medication can be necrotic to the skin, and you can cause an infection, and you're having something totally different to deal with. So you're going to have to elevate that arm. You're going to have to keep hot, cold compresses on there and alternate those. And you definitely want to document when you had the infiltration and where it's had redness or edema. Because if, say, for instance, you come on shift and you didn't assess it and didn't document it, and it's throughout your shift, it's your responsibility. It happened on your watch, not on the patient, or not on the nurse before you, because it may have happened with the nurse before you and she missed it, but you weren't accountable and didn't do a bedside rounding. It's your responsibility, and it'll come down on you. Now, you're also talking about the PCA pumps. You are seeing less of these, but you'll still see them. They will be a method, a way to administer medications, especially pain medications. You have the narcotic medications where they can actually dose as desired, and then they actually feel like they're in more control. You don't see them as often as you did, but you still do. And so it gives the patients the opportunity to feel like they're in control of their pain medication. But it actually does have a lockout to where they can't over medicate. They can only give so many milligrams per hour. Now, this you want to go over your practice questions, review those, make sure you study your resources, guided reading, Elsevier, and regardless of the method is used and the rate you used, you want to follow those fundamental guidelines. And so, just most drugs are administered in a critical care or titrated or adjusted according to the patient's response to drug therapy. You have to watch your patient. You cannot take anything for granted. Okay, if you have any questions, you can email me and I'll get right back with you. Thank you.